At the Victorian Emergency Communication Centre, an urgent call is coming in about a terrifying car rollover on a busy Melbourne freeway.
Is anyone trapped that you know of?
Is there someone trapped? I think so. One of them's not getting up too well. Hang on, there's just a woman running on the freeway now.
911 received.
Intensive care paramedic Cullen is on his way, lights and sirens, to the time-critical case.
There's a possibility that the patient could be critically injured. Head injuries, chest injuries and potentially some fractured lower limb injuries.
As Cullen dodges cars on the freeway, an alarming update is adding to his stress.
It's just been upgraded to a priority 0, so 2 MICA paramedics are going due to the fact that the patient is in an altered conscious state.
The traffic's pretty hectic. We're in the afternoon peak hour, after school pickup, trading knock-off sort of time, so it's really hard to get past the cars. But I need to keep pushing through to try and get there as quickly as I can.
Should have an emergency lane up here, which we hopefully can jump into.
Whenever we go to a car crash that is on a freeway, speed is generally higher and the risk of really severe injuries is massive.
Car's on its roof.
The first thing I see when I arrive at this crash is a car sitting on its roof with someone hanging out the side. There could be dead people in the car as well. This is a huge crash.
Maybe I'm just feeling a bit festive at this time of year. I don't know.
In the Christmas spirit?
Very much so.
It's the start of shift for good friends Leonard and Nat.
So what are you doing for Christmas?
Well, so traditionally we don't celebrate Christmas, being Jewish, but Adrian and his kids celebrate it, so we will be celebrating Christmas this year.
Nat and her partner Adrian are now living together, and his children are staying for the holidays. And that means a major adjustment for Nat and her 3 kids.
So for kids that don't celebrate Christmas, they have really taken to the idea of getting presents.
Christmas is the best time of year, especially for kids. And as soon as Nat exposes her kids to Christmas, it's all over. It's going to happen every single year. There's no going back after this.
What does your mum think about this?
My mum doesn't need to know everything, OK? She's still waiting for me to bring home a nice Jewish boy. If Mum finds out we're doing Christmas this year, I think she's going to be mortified, so it needs to be kept top secret. Support 213 received, code 1. Leonard, we've been called to a male in cardiac arrest and CPR is in progress.
All right, so it's game on.
You're clear on the left.
Another ambulance crew are now with the cardiac patient. But suddenly, Nat and Leonard find out they're being diverted to a second patient at the same address.
We've just arrived on scene. It appears unrelated, but there's an elderly lady who's had a fall out the front. She appears conscious, but she'll need an assessment.
Received. This is the nature of the job. You think you're going to one thing, then you're directed to something else. So up there on the left, yep. There we go. Oh, yeah, there's our patient. Oh, she's fallen. We arrive on scene. I can see an elderly lady sitting on the ground being comforted by a bystander. It's not looking good. Hello.
This is Doris.
Hi, Doris. I'm Natalie. What has happened, Doris?
Well, there was no one home for the man that was sick.
Right.
So I had to get up and hurry down.
Okay, so someone is unwell upstairs.
Yeah, he's on the floor nearly dead.
And you've run downstairs to show the ambulance where to go,
Yeah.
and you've fallen over.
Yes.
Okay. I really feel for Doris. She was just trying to do the right thing and help her neighbour out, and now she's sitting on the ground, bloodied and bruised herself. What a day.
Emergency services, tell me exactly what's happened.
Laurie has a brain tumour and she's just had a fit.
Back at the Emergency Communication Centre, an anxious woman is calling in. Her 69-year-old sister-in-law has recently been diagnosed with a returning brain tumour and has just collapsed.
She had surgery about 6 months ago.
Okay.
And she's just had an MRI about 2 weeks ago.
Marker 30 received.
Intensive care paramedic teams Simon and Michaela are on their way, code 1, to the patient on the Mornington Peninsula.
While a patient's seizing, they're not able to breathe properly because of the muscle contractions going on. This stops them from getting enough oxygen in and delivering that to all their vital organs. If the patient continues to fit for a really long time, this can cause long-term damage to the patient's brain. They just arrived 3 minutes ago.
A local ambulance crew is now at the house and is sending through an update.
The first seizure lasted approximately 2 minutes. About 30 minutes later, that second tonic-clonic seizure lasted 90 seconds.
The seriously ill patient is now being transported with the other ambulance crew, and they're about to rendezvous with Simon and Michaela en route to hospital.
Yeah, left. We want to get Marie out of that ambulance and into ours as soon as possible so we can initiate our intensive care management.
It's all right, Marie. It's okay.
So can I have one of the ALS paramedics?
Well, we need 4 people here, like right now. Has she ever had a seizure before today?
No, never.
No, first seizure.
When someone's got a history of brain tumour and a rapid drop in conscious state, it's probably not going to be good.
Marie, can you reach up?
G'day guys, Cullen from 99, how you going?
On a busy Melbourne freeway, intensive care paramedic Cullen has just arrived at an horrific car crash.
Is it just one patient?
Just one patient.
Yeah.
The crushed vehicle is upside down, with a man trapped in the wreckage.
And we've checked the car to make sure there's not more than one.
Fire is a number.
Okay. Micro response 99, got one patient in the car still. There is a second patient that is decamped from the scene, but we don't know where that person is at the moment. Right, you with the ambulance, mate? Okay, breathe on that, in through your mouth, out through your nose. I'm going to give you a tourniquet. Can you set me up for a line, please?
I'm looking at the patient who's sitting half out of the car. He's not wearing a seatbelt.
I just want to get some monitoring on him before we move him.
There's a high chance that he was like a pinball in that car. Could have collided with the other occupant, the dashboard, the seat, the roof. It's now upside down, so he's been thrashed around and that would have caused a lot of damage.
Can you just give me a rundown of the injuries so far?
Yeah, so sore left shoulder, just pain in his right.
Yeah.
That gash in his right leg.
Yeah, and you're pain in your tummy? Put that in your mouth, mate. Breathe through your mouth. Breathe through your mouth. And it's going to help you, OK? We're going to look after you, but you need to help us.
People, when they've got a head injury or may have low oxygen going to their brain, can be agitated and they can be aggressive to us.
No, you don't want to. All right, just chill, mate. We're trying to help you.
I need to just brush these things aside and focus on getting some pain relief on board to calm him down so that he can comfortably get out of that car and safely to hospital.
That's in, mate. Stay still. Stay still. Have we got that fentanyl handy?
As Cullen gives the man some pain relief, witnesses of the accident are still in shock.
I looked up and saw a car hit the pole and then flip, 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 flip. We pulled over and the alleged driver was there trying to get out of the passenger side and saying, let me out, get me out, get me out. So I just grabbed her under the arms and dragged her out. She was quite hysterical. And then she just bolted up the road here.
The woman's disappearance will now be investigated by police. But Cullen's main focus is getting the trapped man safely out of the car.
100 on 70, but it's not a good reading.
With his borderline blood pressure, it tells me that he's probably got some internal bleeding going on.
The fire brigade are going to chop each side of the car here. We need you to stay nice and still for us, mate.
He might have internal injuries in his abdomen, in his chest. This guy could be really, really sick.
Can I just have a bit of a feel of your neck? Do you have pain anywhere, Doris? No?
Nat and Leonard are assessing Good Samaritan Doris.
Do you know where you are at the moment?
I'm perfectly all right.
What month and year is it?
It's December.
Yes?
2020.
Excellent.
The 91-year-old was rushing to meet paramedics who'd been called to help her critically ill neighbour.
Can we take the glasses off? Leonard will clean you up.
In the panic, she fell, becoming a patient herself.
Are you a little bit anxious about what's happened?
Oh, yeah.
You are? Okay.
I was worried about him. I wasn't worried about me.
Because your heart's racing a little bit, but
Actually, I mean...
Naturally. Okay.
See your nose on the floor.
He's in good hands. We're now here to look after you.
Now, you definitely don't have any pain in your neck or your back, no?
Leonard and Nat would like to apply a spinal collar, but the 91-year-old isn't interested.
Yeah.
Just get me up. I'll get those feet on the ground, I'll be right.
Just a minute. Let's get the stretcher out and then we'll decide where to go from there.
Well, I know what to stretcher.
We've done our basic assessment, but I want to get Doris off the ground into the back of the ambulance so I can assess her from head to toe. OK, we're going to help you up.
No, I'll tell you if I need you.
I offer her help to get onto the stretcher and she shuts me down. She can do it herself. You are speedy, aren't you? Look at you go, go, go.
Determined. Give me your hand, that's it.
Now, just slowly. Just one leg up first. Take your time. Well done.
Well done.
Oh, is that better?
Yeah.
Yes, now I can see you properly.
Gonna give you the royal treatment. So have a seat, put your bottom right there.
I'll do it in the seat.
That's okay. There we go. Okay. And you're normally this shaky?
Yeah.
Yeah? Can I just have a feel of your face? So, smile for me. Any pain in the jaw?
No.
No. Any pain in the cheekbones there?
No.
No? So this cut will need attending to. It definitely needs some glue.
If I go home and sit in my armchair for half an hour, I will be fine.
The problem with heads is that we don't know what's going on inside the heads. We can only see what's happening on the outside. There's always a risk that underneath that cut, there's a tiny little bleed going on, OK? So the advice is to go down to hospital.
No.
No chance.
I can't. Then I've got to die of something.
I know, but not today. How about that? Not today.
Oh, no, I won't die today.
OK.
Simon, ketamine,
Yep.
200 milligrams in 2 mils, expires in 2022.
Yeah, thank you. At the Mornington Peninsula, Simon and Michaela are under pressure. They need to decide whether to put Marie into an induced coma and take over her breathing.
It's okay, Dad. There we go. It's all right. It's all right. Just giving you some medicine to make you relaxed.
The 69-year-old has been fitting for nearly 90 minutes, and the paramedics fear her brain could soon be starved of oxygen.
So I've just given her the 20 of ketamine to settle her. So we're going to move towards RSI. John, Matt.
Only 2 weeks ago, Marie received the heartbreaking news that a tumour in her brain had suddenly returned.
She's not breathing a huge amount.
She's not? No.
Today, she was at the beach with her family, trying to stay positive and come to terms with the frightening news.
I was deeply distressed for her, for what this would mean to her and all, the people that love her.
It's all right, darling.
My sister is a wonderful person, really upbeat, enthusiastic, just really embraces life, lives life to the fullest. There would be a huge hole in my life without my sister Marie.
I need some medals drawn up.
Yep.
My main concerns right now is that Marie's been fitting for a really long period of time. 20 mil syringe,
Yep.
12 mils of normal saline,
Yep.
and we're not sure what's actually going on inside her brain. Additionally, she's not breathing properly and she's not protecting her airway properly, which puts her at risk of not enough oxygen getting to her brain and long-term brain damage, and also aspiration, which can lead to a pneumonia.
Marie's breathing is still so unstable, Michaela and Simon have no choice. They must now intubate.
We're ready to move, ready to proceed with RSI. Does anyone have any questions, any concerns?
We're good.
It's really important that when we're doing these high-risk procedures, such as intubation, that the communication within our team is clear. Everyone knows their role and what is about to occur.
If we're unable to get it in then we'll go back to bag valve mask with an open airway.
Yep.
Can you turn the oxygen off?
Marie is now completely unconscious. She's completely paralysed and she's not breathing on her own. So we have about 30 seconds to put the tube in and start breathing for her.
We've got to keep your arm just still there, buddy.
On a busy freeway, a man is still trapped after the car he was in flipped in a shocking rollover. The driver of the car took off before police arrived.
When you're ready. A few more bangs, and then we're going to put a board underneath you, mate, and get you onto an ambulance stretcher.
Well done, boys.
All right, can we get a couple of people ready with the board? Who's got that pain relief? He's a bit drowsy, so I don't want to give him too much.
The deep cut in the patient's right leg has been bandaged to stop the blood loss.
Can I have that other ampule, please?
But what Cullen's really worried about is the potential for internal bleeding.
All right, on go, ready, set, go. Sit down, sit down, sit down. Sit down.
Awesome, smooth.
Bring him right up so his feet are at the end, and then we're going to lay him back.
This guy has a high chance that he's got a head injury, a chest injury, pretty good chance that he's got a broken pelvis, and I can clearly see that he's got fracture in his lower leg as well. So this guy is a bit like a smashed crab at the moment.
I'm right to move slowly. Yep.
I'm going to start moving towards the hospital. Got a car accident, all right?
Just having a look, mate. Is that painful?
Is it your leg that's hurting? Yeah.
I might give him 10 of ketamine. He's got a fracture there. These bumps aren't going to help things. Just sit down for us, mate. Just sit down, sit down, sit down. I think it's the ketamine. I'm just giving you some medication that makes you feel a bit weird, all right?
If this guy survives, he's got major surgery ahead of him, scans, he's got weeks and months of rehabilitation. He may never lead a normal life again.
I'm going to go inside, okay?
Oh my God, I'm so excited. Cheers.
It's the start of shift for besties Steve and Emily. They're waiting for their first case, but in the meantime, they're in food heaven.
Oh my God.
That's orgasmic. It's like warm inside.
Mm-hmm.
To be honest, this is my first time I've had a tub.
Me too. Me too.
Me too.
Em and I are both very similar in our tastes in men, food, wine, and we definitely love the same snacks.
Oh my God.
Food is so important to us because we need to have our sugar levels high so that we're ready to respond to a job and we can give our full attention to that person.
With Steve's sweet tooth satisfied,
213 and 214 received code 1.
the team's now heading to a Code 1 call for a suspected heart attack.
So we're going to a pain in chest.
It's all happening.
It's all chest pain.
Chest pain can be a heart attack. It could be a blockage in one of the vessels in the heart, or it could be a pulmonary embolism.
Stop.
Please stop.
God, take your time.
Okay, and there's stop on the inside here for you, Annie.
Our bodies are amazing, and chest pain alerts us to the fact that something's not right, and ignoring it could be the difference between life and death.
Can you turn the oxygen off?
At the Mornington Peninsula, Simon and Michaela are putting Marie in an induced coma after the 69-year-old collapsed and started having seizures.
So going down the middle, looking for the molecular. There it is.
At this moment, my heart rate's up a little bit. I'm a little bit nervous because my role is to successfully intubate the patient.
Through the cords.
Yep.
And there's a multitude of things that could go wrong if done incorrectly. You could put the tube in the wrong place in the esophagus and the patient's oxygen levels can get critically low. You could also damage teeth or the airway when you're trying to see where you need to be, which can cause bleeding, which then can go into the lungs.
We'll go down to 22 at the lip.
Yep. Yeah.
Please. Watch your eyes,
You got the
everybody.
tube?
Yep, I've got the tube.
Yep.
Cuff up.
Yep.
Okay. Good waveform.
Once Simon's placed the tube, I'm looking at the monitor to ensure we have a normal waveform to see if the tube has been placed in the right spot and if we are now effectively breathing for Marie.
So chest is clear, good air entry.
After a final check, Simon confirms the intubation has been successful.
End titles of 36. We've got a normal respiratory waveform. When I look at the monitor, I do have a sense of relief knowing that we've got the tube in the right spot. We can now move forward, continue to manage Marie and then breathe for her. So Matt, I'm happy to start moving. Currently, Marie's stable, but she still is critical and needs ongoing care at hospital.
One of the potential causes for Marie's seizures is a brain tumour she was recently diagnosed with.
So she has a meningioma.
Yes, surgery in July to have the tumour removed.
And did it get removed?
As much as they could, but they thought it was very slow further intervention. But on a recurrent scan, it had grown a lot faster than anticipated, apparently.
Okay, all right. Marie and her family have been through so much with the brain cancer, and now to be presented with potentially this seizure activity, potentially a stroke, must be extremely worrying for them. We're really hoping that Marie's going to be okay.
It's good, that pole.
But we also are really concerned because we don't know what the outcome's going to be. We don't know what's going to be on her CT scan. And I am worried that this might be an end-of-life event for her. No guarantees.
I can't go to hospital. I've got things to do.
You know, the concern is you're 91, you're living at home alone independently. We don't want to leave you at home and then something happens to you.
Nat and Leonard are trying to get Good Samaritan Doris to agree to go to hospital.
No, I can't.
Nat's normally a very good negotiator. I would have thought...
I'm not done yet, I'm not done.
Doris fell while trying to flag down another ambulance for her sick neighbour. But she's refusing to go to the emergency department.
Oh, I'll be all right.
We get to a lot of elderly patients who are very apprehensive about going to hospital. They're worried that they're going to stay there for a long time and potentially not come home.
There's a decent chance that when you have a little bleed in your brain, it builds slowly, so you wouldn't have any symptoms now. But in the next 24, 48 hours, that bleed could get a lot bigger.
Is it telling me all the naughty things?
Well,
we have to.
I'm not going to sugarcoat it because I feel very uncomfortable leaving you.
Has he changed your minds?
No.
No, I'm going upstairs.
Is that 100% no? That's a no deal, is it? It's a no deal. I don't think we're going to win this one, Leonard. I really don't.
All right.
Okay. If anything changes, I want you to call us back.
Okay.
Okay? Yeah. Promise me that?
Yes, I will.
Okay. I'm very frustrated that Doris won't come with us, but she seems to understand the risks involved. At the end of the day, every patient has the right to make their own decisions about the medical care they receive.
Now, is there anything else we can do for you?
I didn't want to bring my nephew.
Definitely. So we've got Doris inside, we've spoken to her nephew, he's going to come over and check on her. Makes me feel a lot better leaving her at home.
I will recover very quickly.
I have no doubt, but I've told you what to look out for, and if anything changes, ring 000. Is there anything else we can do for you?
No, you've done enough. Do you want something to eat?
Oh, tempting.
We're good, thank you very much. Thank you, though.
Take the bottle.
No, we're good. Thank you, though. We appreciate it.
You're very
you take
kind,
care, OK? OK, all the best.
Bye-bye, Doris. See you later.
Bye, Doris.
This way, please. Couldn't have done any slower.
Across town, Emily and Steve are driving code 1 to a 70-year-old man suffering a suspected heart attack.
Gloves, goggles, mask.
Mask is I'll pull it up for you.
So much to put on, isn't there? Like when you're driving, especially.
I feel like I'm going out clubbing. Like I need this, I need this, I need this.
Lip gloss, highlighter, blush, yep.
So we're looking for 4A.
6.
4B, 4A.
4A.
Hello. Oh, hello.
Hello.
The team is met with a warm welcome, but need to get inside to assess the patient.
Hello, sir. What's your name?
Asher.
Steve M. What are you called for today, Asher?
It feels like my heart's racing at a hell of a pace, and I've got a funny kind of a pain over here.
Okay. Is this a new pain and new feeling?
Yeah.
What time did it start today?
Late this morning. But I left it and I thought it'll go away.
Okay.
Anyone with chest pain, we always treat cardiac until proven otherwise.
Em's just going to attach this heart monitor to you.
There's many different things that can cause chest pain, but obviously the main life-threatening one is a heart attack.
So describe this pain to me.
It's like sitting over here on my chest.
Yep.
It's gone right in.
Does it feel heavy?
A little bit, yes. It's uncomfortable.
Okay.
It's unpleasant.
Okay. So you don't have any cardiac issues? You've never had stents? You've never had a heart attack?
No.
High blood pressure?
No, I'm perfect.
High cholesterol?
I'm perfect.
Okay.
I'm talking to Asher, and in his own words, he's perfect. But look, at the end of the day, heart attacks can present in many different ways, shapes and sizes. You don't have to be on the ground, unconscious, just before hitting cardiac arrest.
Can I just open this all up?
Sure.
Because we're going to have to paint a very big picture of your heart. Thank you so
What says
much.
I'm heartless? I don't know where you're going to find the heart.
He's got a heart. It's there and it's beating.
You're two outside witnesses.
Yes, you do.
You can be sitting upright, talking, joking, and you can be suffering from a heart attack.
Tell me, you're going to feel good?
Hello, Twiggy. How old's Rocky? 10. Oh my gosh.
It's young.
I loved seeing Rocky sitting next to Ash's side. It was like he was protecting him and he was watching everything we did. 100% I feel like Rocky knew what was going on. I feel like dogs are really instinctive like that. Nice and still, okay?
STEMI. Okay.
I'm looking at the ECG now and it's quite alarming. The monitor has said that Asher is actually having a heart attack.
It is telling us that you've got a bit of a blockage in one of your main arteries in your heart.
Alarm bells are going off in my head and I look at Em and we know this patient is currently in a serious condition.
You need to go up to hospital immediately. Like, this is time critical.
Did you know I was a dental nurse for 5 years before I became a paramedic?
Marley and Taney are just starting their day, unpacking their reasons for becoming paramedics.
What caused the switch from dental nursing to paramedics?
I always knew that dental nursing wouldn't be my forever career.
Taney's now a veteran in the blue uniform, but it was a family tragedy that changed her path in life forever.
One sunny afternoon, my family were involved in a boating accident. So our boat exploded with them all on it and caught fire. And my grandfather and my nana and cousin were burnt quite badly.
Jesus.
On that day, I guess I saw what humanity's really about. It was about the care and the ambos that were there. They gave something to my family that I just couldn't fathom was even possible. I saw what they were doing and thought, wow, that's a pretty cool job. And I just sort of watched how they had this air of calm about them in this really horrendous situation.
I feel like I'm going to tear up.
I just thought, if they have this impact on my family and they do this every job they go to, what an amazing job.
And everyone obviously had a good outcome.
Yeah. I mean, it was pretty traumatic. They saved my family that day, and from that moment on, that was why I wanted to become a paramedic.
Oh my God.
Yeah, that's how I got into ambulance.
As Taney and Marley continue to bond while waiting for their first job,
Just a little sharp sting.
Steve and Emily are worried their patient, 70-year-old Asher, is having a heart attack.
I'm just going to pop GTN patch on. Okay, that's in. Do you feel dizzy or anything?
It's time to doof some more.
Okay.
Okay.
But as the team perform another ECG, the results are changing.
He's got a right bundle branch block. There's no ST elevation. The second ECG that we do in Asher contradicts the first. But regardless, he's experiencing these symptoms and he could potentially still be having a heart attack.
I can just feel like it's pumping.
Yeah.
With Asher's chest pain, he can still be developing a heart attack. It can be quick or it can be prolonged.
Take a seat here, Asher. Perfect.
There's no such thing as a small heart attack, and essentially you can still die. We need to treat that accordingly and get him to hospital.
Now, swing your legs up. Is that pain still there?
Yes.
Okay. I'll give you something else for it. Now, your wife's going to come say goodbye.
Goodbye, dear. Can't remember her name.
Give her a big smooch.
You're hilarious.
Good, stop.
I love it.
PG.
Keep it coming. How long have you been married for?
Well, I said 143 years.
Yeah, and how long
she
did she
says
say?
43 years. So I'll leave it to you guys to work out.
That's what it feels like. We know you love her.
Oh, look, if I had my life over again, it would be the same woman again.
Oh, that's
So she's a good,
beautiful.
wonderful mother and grandmother to the grandchildren.
With all Ash's light-hearted humour, you can definitely tell they're deeply in love and have been for 43 years. Like, you could feel it in the air. They were both very happy with each other and it made me smile.
You good to go, Stevie?
Yeah, I'm good to go now.
It's a quick trip to the hospital, but despite Ash's light-hearted attitude, Steve still has concerns.
So I don't want to say anything in front of my wife, but this has happened a few times.
How many times has it happened?
Once or twice, maybe 3 times max.
Even though Asher is looking quite well, this isn't reassuring for me because if Asher has a clot in his heart, we can't fully discern whether it actually is in there and how big the clot is.
So you've got some dizziness?
Very little. That's what you get excited about.
Alrighty, we'll get you in, Asher, and get you seen.
If they find a blockage in Asher's heart, a team of cardiologists will be waiting to take him up to theatre, and they will remove the clot then and there.
Okay, let's go.
But hopefully they'll give him the all clear and he'll be able to go back home to Joan and then go chill with Rocky on the couch.
When the dog ran out to us, that was my favourite part. I feel like I haven't seen my dogs all week.
Literally, all week.
They get so sassy as well when you leave again. They're like,
I know.
seriously?
Excuse me, why are you going again? The face.
I know, even when you give them a treat.
It's like your sassy face
I know.
that you give me when I leave you. Or is it the other way around?
I'm needy.
You are needy. All's well that ends well. Now get us home.
As Emily and Steve head back to base, Taney and Marley's first job has just come through.
Code 1 was safe, thank you.
It's a disturbing case.
We're clear straight ahead and clear on the left.
2 teenagers have been injured with a knife.
It says patients disconnected after confirming him and his friend have been stabbed. Obviously, we'll consider whether we need air support. They do carry blood to maintain perfusion and keep these kids alive.
When we go to a stabbing, there can be multiple organs that are bleeding out that we don't see until it's almost too late.
I feel like I'm a very cautious driver when it comes to driving code 1s, but for 2 kids, you've got a bit more gusto when you're driving.
Just round the bend. Here we go.
As the team pull up at the scene of the stabbing, they find one teenager has already been loaded into an ambulance. The second stabbing victim is waiting for treatment.
Been stabbed with about a 2 centimetre wide but potentially 30 centimetres long thin knife to his left flank.
So our biggest concern is that we may only see a small wound on the outside, but on the inside, what's actually happening is quite catastrophic.
He is obviously complaining of some pain, but he's also got some referred pain on the right side of his abdomen.
Okay. I'm concerned that this knife could have penetrated his kidney or that he could have damage to his other internal organs. This patient could be bleeding out in front of us, and we don't know yet.
It doesn't feel like a normal stab wound, I can tell you that.
Whoa. Can we have a hand, please?
Suddenly, the teenager tries to get off the stretcher.
Come over. No. Mate, you're going to fall off the bed.
Don't worry.
And I'm worried about your wound, okay, sweetheart? I'm Taney, okay? You've got a lot of pain. You can't wiggle around. The more you move, the more it's going to hurt. We need to get you in the ambulance, okay? The patient's really agitated. We need him to stay still because if he's bleeding internally, that could be life-threatening.
Take that off!
It's a seatbelt.
I know.
I need to leave it on you.
Trust me, I'm gonna behave, I promise.
No. It's not a restraint. It's just because I'm a terrible driver, that's all.
Reassurance is key for us in every job, no matter the acuity, no matter the type of job.
I don't like that, I'm claustrophobic.
I'm worried about you.
Don't do that to me, bro.
This patient has a high heart rate. Assessing someone that's agitated, their vital signs change. So we were trying to calm him down so we could best assess what his numbers were actually doing and understand what's really going on.
I just need to have a little look at this wound, okay?
As Taney and Marley try to keep the agitated patient under control,
Yeah, sure.
intensive care paramedic Steve has arrived as backup.
So just there.
Right, okay, so
Yeah.
potential kidney.
Yeah.
What I'll do, mate, I might come with you.
Sure.
When I hop in the back of the ambulance, I'm worried where the knife wound is, that it may have hit his kidney, and the blood supply to the kidney is quite high.
All right, mate.
He could go into cardiac arrest and die whilst en route to hospital.
Do you want to watch me die?
No, I won't do that. That's why I'm coming down here, mate. Just for you, buddy. How big did you say the knife was?
About 30 centimetres.
It was a decent blade. Thin. Like a
thin, quite thin, yes. Yep.
Gee whiz. It's just where it is. It's the angle of the blade. As it touches your diaphragm, as it touches the lung. I'm extremely concerned about internal bleeding and the potential for him to rapidly bleed out in front of me. You don't have any discomfort down here, mate, just where I'm pushing down in your groin area?
It's hurting back more on that side than it is on this side.
Yeah.
And you said before you weren't knocked unconscious. Is that correct?
No.
You can remember everything that happened?
I remember it. Straight away, he pulled out the knife.
Right.
Nobody fights with their hands anymore,
It's
yeah?
a thing of the past, fighting with your hands, isn't it?
But don't worry. In a couple of weeks' time, you're going to be picking up somebody for a stab wound too. I'll be a real man. I'll be a real man.
Mate, I'm going to tell you as a 44-year-old man what a real man is. One who says, enough's enough, buddy. No one else needs to suffer.
I understand what you're saying, man.
You got the whole world ahead of you, champ. Nice young fella. You don't want to go get yourself into trouble, mate. You know, you got potential relationships, you got kids, you got careers, cars, houses, holidays, just everything ahead of you, mate. Everything. I can actually see my son in this boy and some of the problems that he's having. I can actually relate somewhat to, and I can't help but actually feel a lot of empathy for him as a father. And you got to think of your family, mate. Think of your brothers and your sisters, your mum, your dad.
That's what I'm thinking about. I don't want nobody to go pick on my family.
Yeah, but they don't want to be visiting you in prison.
You know, he's been lucky. He's still alive and talking. I really hope that he learns a lesson that a lot of people don't actually walk away from these injuries, and they can actually die.
We're here. Do you want a blanket?
No, I'm fine, thank you. This whistle is taking away everything.
We arrive at hospital and this young man will certainly go for scans. You'll have a trauma team assess him. He'll have some antibiotics, and I believe he'll probably end up in surgery later tonight.
Do you like your job?
Yeah, it's a good job.
You have to deal with dickheads like me, though.
Oh, you're not a dickhead.
I was for a bit.
Yeah, but that's all right. We're all good now, aren't we?
Yeah, we're all good.
I'm really hoping this young man pulls through without any major consequences as a result of his injury and goes on to have a successful life free of any more violence.
Are you a little bit anxious about what's happened?
Oh, yeah.
It's been 4 weeks since 91-year-old Doris had a nasty fall as she was trying to flag down an ambulance for her critically ill neighbour.
Let's get the stretcher out and then we'll decide where to go from there.
No, I don't want a stretcher.
The good news is the neighbour survived, and Doris eventually took Nat and Leonard's advice and went to a doctor to be checked out.
Well done.
Oh, is that better?
Yeah.
Yes.
While Doris says she's doing just fine, her nephew is continuing to check in on his very independent auntie. The passenger in the horrific car rollover on the freeway was treated at hospital.
Just sit down for us, mate.
And luckily survived the massive impact. Police are still making inquiries about the alleged driver who ran away from the crash site.
What says I'm heartless? I don't know where you're going.
Asher spent the night in hospital undergoing multiple cardiac tests.
Let's go.
Luckily, results showed the 70-year-old did not have a heart attack, and he was sent home to a very happy Rocky.
It doesn't feel like a normal stab wound, I can tell you that.
The young stabbing victim was lucky to survive after doctors found the knife had penetrated his kidney.
Do you want to watch me die?
Fortunately, no surgery was required, and he was released after 48 hours. Marie was diagnosed with a recurring brain tumour and was rushed to hospital after a terrifying seizure.
It's okay, Dad. There we go, it's all right.
Simon and Michaela had to put the 69-year-old into an induced coma, but had grave fears that Marie wouldn't survive.
Certainly love these pats, don't you?
Her sister Claire was devastated.
I hated seeing someone I love so much suffering like that. It reminds me of, how fragile life is and, expect the unexpected.
Bought you a cuppa, Claire. What are you doing reading a book when you've got Maggie there to love and hug?
Against the medical odds, Marie made it. But she spent 2 weeks recovering in hospital.
I have no memory of the seizure at all. No memory of the lead up to the seizure. It's like there's a chunk missing out of my life.
Now Marie's booked in for radiation therapy to shrink the brain tumour.
I'm excited that it seems that it's really going to happen after having a few postponements.
And she's looking forward to reuniting with her Canadian partner Patrick when the borders open.
Patrick and I plan on getting married in the Galapagos Islands. I'm the luckiest. I am. I'm just so grateful to be here. Thank you so much for everything. There's a lot to look forward to. And life's short, you just got to live every day, don't you? The sun's going to rise every day, and that's a great thing. So just be part of it, part of life.